Hey folks, Dr. Walker again. Welcome back. So let's talk a little about statins today and some of the potential complications associated with them. So physicians are to tell you that there are some associated risks, quote, and that they are low when it comes to things like fatigue, lack of focus, lack of energy, lack of that get up and go kind of action. Muscle aches and pain as well. But again, it was to tell you that those risks are low. Anyway, so some of the areas in the body that the highest concentration of mitochondria happens to be in places like your brain, your heart, and your muscles. The importance of mitochondria is that it's really like the gas tank for your car, or in this case, the gas tank for your cells. What that means is that I need to have elevated or high normal mitochondrial function, gasoline for my car, in order to not have things like brain fog, muscle aches and pain, normal heart rhythm, and those kind of things. I'm supposed to have adequate function in those body parts, again, brain, heart, muscles, to function normally. But also tell you, again, low risk. What I'm supposed to tell you is that statins tend to decrease the energy to all of those areas, all the mitochondrial activity in those areas. So you may feel, again, low risk, quote, brain fog. You may feel fatigue. You may feel muscle ache and pain. Some things along those lines. Again, where you have elevated levels of mitochondria, those things may be affected. I say that to say not all is woe, because there is a supplement you can take, CoQ10, and specifically the active ingredient in CoQ10, which is called ubiquinol, Ubiquinol, the active ingredient in CoQ10. If you are on a statin and your provider has not given that supplement to you and or suggested supplement to you, you need to make almost a demand to say, I need to have the supplement added to my statin. Again, I'm not a statin person. However, if you are on a statin, I believe you should have the discussion about adding CoQ10 and specifically ubiquinol to your list. Because again, statins will decrease the HMG CoA Reductase pathway. It certainly does. But equally, it'll also disrupt the CoQ10 pathway, which means that it's blocking both of those pathways. So the pathway to reduce your LDL cholesterol, which is what it's supposed to do, and a pathway to reduce your CoQ10 pathway, which gives gasoline to those mitochondrial cells, both of those are being diminished by statins. And yes, I'm supposed to tell you that the risk of those things that happens to you or can happen to you is low. And also they may tell you that the fatigue you have, they meaning providers may tell you, the fatigue you have, the memory fog that you have, the muscle ache and pain that you have, all of those things are, quote, in your head. But again, the pathway for decreasing your cholesterol and the pathway for giving energy to those mitochondrial cells are both being diminished. Thanks for listening.